When I first started my practice, I was always very curious about why people were so tired. I had 18-year-olds coming in and telling me that their main symptom was fatigue. I had 90-year-olds telling me that they had been tired for 40 years. So as I started running lab work, I started noticing a phenomenon with so many people's thyroid. And so in this video, I want to talk a little bit about hypothyroid and Hashimoto disease. So the thyroid is an interesting thing because what happens is you need thyroid in order to make energy in the body. It helps with a lot of things. So some symptoms of hypothyroid is people who are gaining weight rapidly, people who might be working out and can't get the weight off, if you're losing some of your eyebrows, your hair is falling out, constipation, feeling swollen by the end of the day, having a difficult time swallowing. There's lots, and of course, there's also patients who have no symptoms and then their thyroid comes back messed up. So basically, hypothyroid is the idea that you're not getting enough of what's called your T3 and your T4 peripherally in the body. And that is sort of your energy center. It goes in and it makes energy in the body. So then it tells the brain, hey, I'm not getting enough of this. And so the TSH, which is the thyroid stimulating hormone, starts to go up. And so it makes it hard for women to lose weight. They're tired, they're exhausted, they have brain fog. So that's one thing that happens with hypothyroid. The other thing is that with Hashimoto is that there's not only maybe hypothyroid, but you're also having an autoimmune reaction. And basically what that means is that your thyroid is attacking itself. So in my mind, if I'm talking in layman's term, basically the thyroid sends a signal to the immune system that says, hey, I need help over here. And the immune system shows up and it goes, nothing's going on. And so after so long, it's just like, well, I guess I'm just supposed to attack self because I'm getting a signaling that something is wrong, so I'm just gonna attack my own soldiers on the thyroid. And that's what the Hashimoto antibodies are. The immune system is turned on itself and is now starting to attack part of the thyroid. Now, my biggest thing is that back in the day, hypothyroid used to be called toxic thyroiditis, meaning that when the body gets so toxic, the thyroid is going to go out. And also, the thyroid is not protected by a visceral sac. Your lungs are protected by a sac, your heart is protected by a sac, your liver is protected by a sac. So that means when the body starts to get really toxic, the thyroid can be the canary in the coal mine, meaning that something is wrong, and that's going to be your first sign that something is wrong, is that the thyroid is starting to look a little bit off. So oftentimes, I have had Hashimoto patients come in and we've had almost 100% success rate getting patients antibodies down into a normal range, so getting people out of Hashimoto. Now in conventional medicine, Western medicine or allopathic medicine, doctors will tell you once you have Hashimoto, you have it forever, so there's no reason to run antibodies. And that's absolutely incorrect. If your thyroid is off and you have Hashimoto, there is something in the body that is tripping the immune system to say, I need you to keep creating these antibodies. So I always start with the gut with Hashimoto. With Hashimoto is we have to close up the gut fenestrations. So people have gut permeability. The hip new term for that is leaky gut. And all that really means is that you have food particles that are fermented or partially broken down that are being reabsorbed into the system. And they'll hit the thyroid, they'll hit the joints, they'll create ammonia, they'll create LPS. It's a whole nother conversation later. And it'll cause this reaction. And after a while, the immune system is like, I am so overburdened, I'm gonna put on a mask and I'm just gonna start shooting blanks. And that's where we really start to see problems with Hashimoto and the thyroid. The other thing that there's correlation in a lot of research is that Hashimoto is linked to Epstein-Barr virus and it's also linked to H. pylori. And so sometimes people will be having stomach problems for a while and they're getting GERD or heartburn, and then all of a sudden they're having a hard time swallowing and they get their thyroid checked and it's an issue. And so a lot of times there's either a stealth infection that needs to be dealt with, the gut needs to be dealt with, and then we watch antibodies go down. We do a lot of hot and cold therapy on the thyroid as well, because if you can get new blood flow to your thyroid, then it's going to flush and it's going to help bring in fresh blood and it'll stimulate the thyroid to kind of absorb some of that. The other thing important to know if you're dealing with Hashimoto is you have to bind out those antibodies. So lots of times if my patients come in and their antibodies should be under 12 and I've got them up to 4,000, I know that their liver is congested and I have to detox those antibodies out of the system. We have to bind them up and get them out. So there's another component to that. The other thing I tell my patients, and they hate hearing this from me, is that you cannot be eating gluten and get rid of Hashimoto. It creates a huge issue in the body because gluten breaks down into gliadin. It's a ginormous protein that the body has not evolved quick enough for the pancreas to make something to digest it. So now you eat gluten potent, it goes in into gliadin and it paper maches the colon and it keeps that leaky gut leaky. And so that's one of the first things you have to do is change your diet. And we do a ton with diet with Hashi, and we do a ton with diet with hypothyroid, but we've had a lot of success rate with minimal supplementation, diet change, some emotional work, hot and cold to the thyroid, as well as going to the underlying cause. The other thing I just want to point out about Hashimoto's, if you have a daughter that might be like 10 to 14 and they're getting tired and having migraines and their period has started, it's really irregular and bothersome, and you're just like, something's wrong here. Maybe they've got what we call allergy shiners where their eyes look really hollow, or there's the purple lines. I really suggest you go get them checked for hypothyroid with antibodies for Hashimoto, because that's an epidemic I'm seeing in my own clinic, is girls from the age of 10 to 14 with Hashimoto. Now, Western medicine is going to run a TSH, and that's just not going to be enough. So if you want to go talk to your doctor, I would definitely ask for a TSH, a free T3, free T4, antibody titers, and a reverse T3 to have that done. So you can see what's happening at the whole level of the thyroid. But there really is a large amount of people who are having problem with Hashimoto who are younger. So I check that with my patients. Then I do a stool test on them. We find H. pylori, we find Epstein-Barr virus, and we treat it, and their Hashi goes away. So there's always an underlying cause. If you're working with a doctor right now that tells you hypothyroid is the rest of your life, Hashimoto is the rest of your life, it's just not good enough. So I would say definitely reach out and find somebody and maybe ask them these specific questions of what is causing this, how can we get to the underlying cause, can you please run these tests, can we check me for these infections that I've discussed. We've also had a lot of success of getting patients off of their thyroid medication. Some women, I can't pry thyroid medication out of their hands. They want it for the rest of their life, and I respect that, and I'm totally okay with it. But some of my patients want to get off of it, and we've had a lot of success with that as well. So treating the underlying cause for hypothyroid is going to be a big deal. The other thing with women dealing with hypothyroid, if I could give you one piece of advice, is take some time out for yourself. As women, we go a million miles a minute. We take care of our babies, we take care of our loved ones, we take care of our partners, and we never take that moment for ourselves. But part of your thyroid is telling you, this is my voice. This is me saying, I get a minute for me. And so it's really important that you get some balance in your life where it's like, okay, we have the holidays, I have to get all my gifts, I've got to see my parents, I've got to see my husband's parents, or my partner's parents, and after I'm done with that, I'm going to go on a girls trip with my girls, or I'm going to go to the spa, or my favorite alone time is reading a book. So that's my biggest advice for women dealing with hypothyroid, is please find that balance in your life so that your body can heal. The reason your thyroid has become hyper for a lot of women is because you're burning the candle at both ends, and eventually the thyroid gets burnt out as well, plus underlying causes.